Hello, everyone. Scott Moore, the AAA's HR and operations consultant, also one of the ambulance cost education faculty. Well, it is here. We are in January. Happy New Year. But for 50% of the EMS organizations in this country have already been selected, and January represents the beginning of what will be, for many of you, the start of the data collection period. For the other 50% of those EMS organizations that have not yet been selected, you need to know you are automatically included in next year, 2023's data collection, for which you will collect data in 23 and report in 24. But for the 50% that are up and up right now, the year has started. So we wanted to make sure that we got to you quick and early on to give you some pointers or sort of some things that we think as this this first month in the year begins during your cost collection year, it's important that you at least start to work. These are things you need to do today so that you can accurately and adequately report your data over the next, or collect your data over the next 12 months for reporting by May of next year. First and foremost, if you haven't already done so, you need to sign up for Amber. That is the software that the AAA created to begin to collect data and to facilitate what will be your reporting of data to Medicare by May of 2023. I'll give you more information on how to sign up for Amber in a few minutes. You also, if you have been selected, actually, this is good for any email service, you need to be checking PCOS, the Provider Enrollment and Chain of Ownership System. Formerly you used to fill out 855B forms. The Provider Enrollment and Chain of Ownership System, PCOS, is a system where you have all of your information relative to your system, relative to your Medicare enrollment. It's important that you should go in, log into your PCOS, and make sure that all of the information is up to date and accurate. You should have already been notified by your MAC if you haven't already, but if you haven't, either way, you need to notify them whether you're going to be reporting on a calendar or a fiscal year. So if you haven't done so already, reach out to your MAC. You should take a snapshot of all of your personnel and the position that they are starting the data collection period in, because under the labor reporting part, section 7 of the tool, they want you to categorize the hours and the wages of all personnel based upon the position that they held at the start of the data collection year. So if you have an EMT who started 2022 as an EMT, but in March becomes a paramedic, you still need to report all of their hours and their wages in the EMT category. More on that. There's plenty of education available for folks, but just make sure that you take that snapshot of your whole roster right now. And as you have people join, again, take that snapshot. If they change during the year, you need to have a mechanism for tracking their hours and their compensation and making sure that you can include it with the category of individuals that as they started that beginning of the year. For those of you who use volunteer labor, you are going to have to report the number of hours that your volunteers work. Many of you probably don't have a mechanism for tracking time. You need to establish a mechanism for tracking your volunteer employees' time so that you can report that next year when it's time for you to collect your or report your data. Now, additionally, make sure you want to do this now. Make sure that you've checked not only your dispatch software, but then also your procedure to ensure that you're capturing any time that your sort of time on task. So if your ambulance transports out of the service area to a receiving facility, calls clear, and you don't have a mechanism for determining when they're back in the service area, you want to make sure that either your software is collecting that, or that in your practice or procedure that your dispatchers aren't marking those folks clear until they're actually back in your service area and available to take another call. More on that as we get through this year in educating folks. The last pointer, because these are supposed to be quick, is if you haven't already done so, have the folks in your billing office or your billing agency go in and check your billing platform to ensure that all of your payers are appropriately categorized, because under the cost collection tool, when you get to that revenue section, section 13, you are going to need to be able to report those payers or that revenue based upon these categories: traditional Medicare fee-for-service, the Medicare managed care plans, Medicaid traditional, Medicaid fee-for-service, Medicaid managed care plans, TRICARE, VA, commercial insurance, and here's the one that a lot of folks can't pull out separately, is workers' compensation, because you could have a claim you could have a carrier who has either a commercial auto or a workers' comp. So you need to be able to identify when you have a comp payer versus when that payer is acting in some other commercial insurance. So lastly, patient self-pay. These are those co-pays or deductibles, or any time that you're actually trying to collect money directly from the patient. So those are the things that you need to be doing right now as you prepare to collect your data, or as you start that data collection period. Probably one of the number one most important things that you can do is go ahead over to either the AAA's webpage and follow the link for cost collection. You can certainly go to emsamber.com. On there, you can either request a login, username and login to Amber, or if you're already a member of AAA, you already have access, and you certainly can log in and start to build your ambulance data collection within the platform. The advantage to Amber is that you can verify, validate, and ensure that you have accurate information before you're required to submit it through the Medicare tool. So promise to keep these things brief. So that's a quick what to do for cost data collection in January. If you have any questions, send those questions into hello@ambulance.org. It'll get routed to one of the cost education faculty, and we'll make sure the stakes could not be higher. Make sure we get this right. Again, hello@ambulance.org. With that, I can't thank you enough.